Hello, everyone. I have another special guest on the show today coming to us from the UK, and it's Coronation Day, actually. So we were just chit-chatting about that a little bit. Ellie, welcome to the show. Thank you so much for being here. How are you doing today?
Thank you so much for having me. I'm so excited to talk to you. As I've already mentioned, I'm a long time listener, so lovely to meet you properly. I'm doing okay today. Got a bit of pain going on, but yeah, all right. I've got my trusty hot water bottle on me at the moment, so that's helping.
Yes. Oh, good. Well, thank you for being here. When you're not feeling 100%, which we all understand. We're usually all sitting with our hot water bottles or
Yeah.
heating pads or whatever that we have. Well, why don't you tell us just a little bit about yourself? Anything and everything you would like to share.
Cool. Yeah. So I live in Coventry, which is a fairly small city in England. I live here with my partner Lewis and my cat Oscar. Um, for a day job, I am an editor for an online university here in the UK. I don't know what else to say. Oh, I have a
Yeah.
PhD as well, which is an interesting fact about me. So, yeah, there you go.
Wow. That's a lot of school.
Yeah, a lot of
Lots of
school.
years of school.
Yeah.
That's amazing. What a huge accomplishment.
Oh, thank you.
Congratulations.
Yeah, it was good. It was good. Yeah, finished that in 2021. So it's been a couple of years since I graduated from that now, and I've kind of taken a move more into kind of the editorial world. Some of that is linked with being, very poorly and not really able to kind of pursue an academic role in that kind of world because it's just so full on all the time. And as I'm sure a lot of people can relate to, stress is a massive trigger for me. So yeah, but really enjoying my kind of new career path as well.
Oh, that's wonderful. Okay, good. Well, that's exciting. I mean, it's a big deal to get your PhD, so you should be very proud.
Thank you.
Congratulations. That's awesome. Well, speaking of endo and stress, and I love to get into that more. I feel like I should have a whole show on stress eventually. But so for you, I always like to start off with how did you start to realize something was off? When did you start maybe feeling some symptoms?
So for me, I think it was pretty much from when I first started my periods, but didn't really have any awareness that a lot of my symptoms could even be endo until last year. So it's been quite a long period. So I started my period when I was 11, but only sort of just turned 11. So I was quite young.
Yeah.
Um, and I think I first kind of visited my doctor for painful, heavy periods at 12. Um, and yeah, I didn't really, only got my diagnosis when I was 29. So yeah, quite a long time. Um, a lot of my symptoms, I think, growing up, I never linked together. And it was only last year that all the kind of things seemed to click into place. And it was like, I still remember vividly the moment of realization that, oh my God, I think all of this is linked. Because lower back pain was more of an issue for me before the kind of period pain, bowel issues from very early on. Um, Also, a lot of mental health issues during my teenage years. Um, and whether looking back on that now, I don't know whether some of that could have been linked from going on birth control so young, because I think they first put me on the pill when I was 13. And then I was essentially on hormones all the way until I was 28. And I do look back now and think, was it that kind of that triggered a lot of the mental health issues as well? But yeah, that was a big one for me. Sorry, I've been rambling now. I forgot what your initial question was.
No, that was, I mean, perfectly answered. So early, I mean, so starting at really at like 11 years old. So through middle school, well, we call it middle school, high school, they put you on birth control at such a young age. Were you still each month struggling, or did you have bowel symptoms outside of your cycle? How was kind of middle school, high school for you? Were you missing classes? Do you remember?
Yeah, so once I went on the pill, I do remember it getting a bit easier. And my GP had advised that it was fine to take them like back to back. So a lot of the time I'd take it for 3 or 4 months back to back and not have a period. So I was just like, I, don't want to deal with a period,
Right.
because they were never nice. They were never as debilitating as they are now, since kind of last year. I mean, I'll get into it a bit later, but I very much had that type of endo that I had like one flare that triggered a complete change in my body, and then after that, it was almost like daily pain.
Mhm.
So before that happened, they were never as bad as they are. Um, but yeah, bowel symptoms on and off, but I never linked them up to my cycle, never tracked my cycle. My cycles
Right.
were always really irregular anyway. And because I was on birth control, I was just, trying to avoid having a period. Um,
And did
yeah,
you think, like, were you like, this is normal? Like, you were just like, this is what I have to deal with, and and other people are probably dealing with it, but we're kind of behind closed doors and no one's talking about it?
absolutely. I mean, it was just painful periods were just normalized. I remember being told by the doctors, you're just unlucky. And my mum was the same. She always had horrendous periods. She used to say she spent, 3 days curled up on the bathroom floor.
Yeah.
Um, so it was just kind of normalized, and the doctors never seem worried. And, when you're that age, they are the voice of, medicine, and you're taught to kind of listen to what they say, and that's it. And of course, now, I know that's absolutely not the case. And it's
Yeah.
so important to kind of fight for your own um, health and really learn to kind of challenge doctors in a kind of diplomatic way, I think. But yeah, it was completely normalized kind of growing up. Um,
And I think at those younger ages too, like the doctors don't take, at least from what I've gathered and parents that I've talked to, they just don't take you as serious when you're at that younger, like kind of preteen, teenage years. They're just like, oh, you're just a teenager.
yeah, absolutely. And the lower back pain, particularly, because I went back about that so many times. And it was just getting to a stage where they were just saying, it's muscular. You've just got to, get stronger, exercise more, and all this. And then the more and more exercise I did, the worse it got.
Oh,
And it was just like this absolutely like burning, like twisting pain in my back that would always get worse when I lay down. And um, yeah, it was always dismissed. And I never even thought it could have been linked with anything kind of gynecological. I say that in air quotes because we know that endo is more than that.
yeah.
But yeah, never ever put two and two together, particularly with the bowel symptoms as well.
Yeah. What were some of the bowel symptoms, if you're comfortable sharing, that you had, just for people who are
Yeah,
listening?
sure. So for me, it's basically been really chronic diarrhea. It was never as bad. It used to come in waves as a teenager, but there would be extreme urgency. Like I
Hmm.
remember some really horrible experiences I had when I just couldn't get there in time, and you're a teenager as well, and it's just absolutely awful.
Yeah.
Um, and more recently, before I had my surgery last year, it was the absolutely chronic. I was going up to 15 times a day and passing a lot of like clear kind of mucus. Sorry if that's too much
No,
information for everyone, but
no, very
these are the
helpful.
sort of things I needed to hear.
Yeah.
Um, but when I was going through that, because they just kept putting it down to IBS. And that whole, if it's normal for you, and because I had it since I was 12, 13, I did class that as my normal.
Yeah.
I just kind of got on with it, and yeah.
Right. You learned it, you adapted, right? You just
Yeah,
adapted your life to live with that. Oh
yeah.
my goodness. And you mentioned nausea too. I'm
Mhm.
sure with going to the restroom that many times, or the bathroom or the toilet, um, your stomach was probably just upset.
Yeah, yeah. And then, the painkillers that you often have to take to get through the pain make you more nauseous, and it's just an incessant kind of,
Yeah.
yeah, cycle. I Last year, which was kind of like my worst year after I had that first episode, um, I remember, because I fortunately work from home most of the time, and work were very understanding, and whilst I was going through all that, to just say, only come into the office when you can. So I spent a lot of time working from home. And I remember just sitting at my desk and like constantly feeling nauseous and then just having to run to the bathroom because I just get these waves of unbearable nausea. And it was absolutely awful. And that was actually one of the symptoms that went incredibly quickly after I had surgery, which was amazing. So
Good. Okay. So you go through, middle school, high school, you take birth control and you adapt. You just
yeah.
adapt. And you mentioned mental health, which I want to get into too, but how could you not have a lot of additional stress? Being teenagers, first off, is so tough. Like that is just such a tough time in life, but to have these unexplained chronic, almost back pain at such a young age, and then, diarrhea that you're going multiple times a day, how stressful for such a young person. So as time goes on, right, you go through school, go to university, what starts happening?
So when I went off to uni when I was 18, I had my first I think it was called Implanon now. Is it Nexplanon now, which is the implant in your
Oh, like the
arm?
shot? Yeah. Or
Um
it's like they keep it in there, right?
yeah, it's like a little like plastic tube that sits in your arm and releases the hormones over I think it's three or 4 years. And I had my first one of those fitted at 18, and that basically completely stopped my periods. And which was great because I was just going off to uni. I did not want to be worrying about any of that stuff. And
Yeah.
yeah, I just spent I'm just going to double check my notes, but yeah, I mostly spent a couple of years just without any periods and thought this is the best thing ever. And yeah, but in the end went through, I think, 3 lots of implants. And it was only kind of going back over my notes last year that I realized that my symptoms and all my doctor's visits coincided with when these implants were due for removal. So really the signs were there at the time that the hormones were kind of suppressing symptoms. And then every time they were kind of running out and needed replacing, I'd start getting the really heavy periods back again and nausea and vomiting and all that. Um, um, yeah, and then when I was 20, I started having some regular bleeding. I think I essentially was bleeding for about 2 or 3 months without stopping, but it was very light. It was more like spotting. And I went to the GP about that and had my first ultrasound. And they found that I had polycystic ovaries and that there was a polyp in my uterus. So I had that removed at 20, and then was kind of told after I'd got the polycystic ovary diagnosis, although that's all been very bizarre because some doctors seem to say that I have PCOS, some doctors say I don't. But as soon as I had polycystic ovaries on kind of my medical records, it was like that was the cause of any of those issues.
Everything that you had, now they're,
Yeah.
oh, well, you have PCOS.
Yeah. And of course, I already had anxiety on my record. So it was always, is your anxiety exacerbating the pain and all that as well? So yeah, it became quite difficult to get anywhere after that. And I would, just go through that cycle of having a few good years with the implant and then everything happening again and talking to the doctors and, having various exams and them just saying various tests and all sorts and just getting IBS and polycystic ovaries and all that. And then when I was 27, I think I just decided, I think I'd started reading a book, you might be familiar with it, called This Is Your Brain on Birth Control. Might have got the title slightly wrong there. I think it's by Dr. Sarah Hill, and I'm really sorry if I've got that wrong. But that started me thinking about the fact that I had been on hormones for so long.
Yeah.
I really wanted to just experience what my actual periods were like again. I don't know why I went in with this really positive mindset of thinking they might just be fine now.
I'm
um,
older. It's fine. Yeah.
it's like, I mean, that was another thing, you're constantly told when you're a teenager, it's just part of being a teenage girl. They'll settle
Yes.
down, they'll get better.
Yes.
So yeah, I went in thinking like, oh, this is great. I'm finally going to get my cycle back. And I started properly tracking my cycle, learning about, the different phases of the cycle and the different kind of moods and things that come with that. And it was really, really empowering in one sense. And then the period started, and yeah, they were just horrendous, and like vomiting and being crippled in pain. Um, and that went on for about a year, but it was cyclical. It was always just around my period.
Right.
And then in March of 2022, so last year, um, it was just like a Friday evening after work, and I had quite a stressful week at work. And I just suddenly got this like knife in the ovary kind of pain, and yeah. And then from then on, that's like a really kind of changing moment for me. And that ended up in, 2 visits to A&E. I was in and out of hospital for a few weeks, kept getting discharged by gynecology. It was a pretty awful time.
Do you think you had a cyst rupture?
So
Maybe?
that was my immediate thought.
Sure.
Because I already had polycystic ovary diagnosis, I'm more prone to cysts, and I thought that must be what it is. But when I went to A&E, they took all my bloods were normal apart from a slightly elevated white blood count, and I had traces of blood in the urine. Got past the pillar and post essentially. They agreed to do an abdominal ultrasound, but they wouldn't agree to do a transvaginal one to begin with. Yeah.
I mean,
yeah.
how can you see anything on the abdominal one? I mean, I think they can see some things, but I think the transvaginal is what would show. I'm not a doctor, but that's what shows usually most things.
So they did the abdominal one and had this horrendous consultation with a urologist, I think he was, who basically said, it's very strange that you're in so much pain because your scan's completely clear. Left that feeling just horrendous. And by this point, this was right at the beginning of it all really kicking off, and I hadn't done all the research I've done now. So I really came out of that thinking like, am I massively overreacting to some normal pain? Because it wasn't during my period either. I think it was about day 13 or 14 of my cycle. So now I know it was because I was coming up to ovulation.
Ovulation, yeah.
For me, that was sometimes worse than my periods, to be honest. So, I got told by 2 people it was a urine infection, but the test that I was having by the GP showed that my urine was clear. In the end, I ended up paying for a private transvaginal ultrasound, which again showed nothing. So, by this point, I think I had then told myself, well, maybe it was just a really bad urine infection and I'm just massively overreacting. But my pain was massively in my left side. And at the time, I thought it was my left ovary. But now, after the scan that I had with the endo specialist, which I can talk about later, he told me that my ovaries are quite high up. So I now know that I had a nodule of endo on the left ligament of my uterus, uterine sacral ligament or something.
Sacral ligament. Yes.
Yeah.
Oh, that's the back pain, I bet, right there too.
Yeah, exactly. And I remember asking this one consultant, probably like the third one I'd seen in 2 weeks, when they just kept sending me to the emergency gynae and then kept, discharging me. I said to him, why would a urine infection cause such severe pain in my left side? I don't understand why it's there. And also I was having absolutely no burning or pain with urination, but
right. It makes
like I'd had urine infections growing up. I used to all the time as a teenager. I knew what they felt like.
Right.
He honestly just shrugged at me. He just shrugged, and that was it. And it was at that point that I think I pretty much gave up on the NHS and just thought, right, I'm going to have to take this into my own hands because, I couldn't live with it anymore when it started getting just constant. I thought it was going to be something that I went into hospital for. It would go away. I'd get treated, and it just never really went.
Right. Gosh, what a terrible experience. I'm so sorry that happened to you. And this is a year ago.
Yeah.
Like, this isn't 10 years ago. This is 1 year ago. So sometimes I feel like, oh no, we've come so far, but this was 1 year ago that you were still being completely dismissed and
Yeah.
in excruciating pain.
Yeah. And it continued like that for a few months, and I kept just having to call the doctors, and I ended up getting 3 different referrals because I remember one GP getting very huffy with me because I couldn't make my mind up whether it was GI issues, whether it was gynecological issues, and she was like, "Well, which one do you want me to refer you to?" And I was like, "I don't know. I'm having urine
Right.
symptoms,
All
I'm
of
having
them.
GI symptoms, and all of them,
All of them. Yeah.
and at this point, I still hadn't really started looking into endometriosis properly.
Sure.
And yeah, it was never ever mentioned by the doctors. Though I was never asked about kind of my history with periods and things like that. And then after a few months, I obviously just thought, right, that's it. I'm going to have to start researching. And as I said, I have a PhD, so once I get into research, I'm like down a rabbit hole.
Right. You're deep in there.
Yeah. So I dread to think how many hours of my life I spent last year listening to podcasts, reading research articles, all sorts.
Did you just know, like your gut intuition, you were like, I know something is wrong. These people don't understand. Like at that point, you were at like a breaking point where you're like, no, something is wrong with me. This isn't IBS. This isn't a urine infection. Like
Yeah,
maybe it's PCOS, but you got to that point where you're like, I know something is going on.
exactly. I
Yeah.
knew that it wasn't normal that I was going to bed every lunchtime and then going back to bed every day after work and
Yeah.
barely managing to hold down my job. I mean, fortunately, the job that I was doing at the time, it was not as demanding as the one I'm doing now. And it really was only that and the fact that they were very understanding about letting me work from home that I was able to continue working. And
Yeah.
I hear, I'm on various endo support groups from the UK, and the amount of women who are just losing their jobs because of this condition, and the lack of understanding in the NHS, the lack of excision specialists. Yeah. Sorry, I went off tangent there.
No,
On a
that's
rant.
good though. I mean, that's good, relevant for people who are listening. And, I've talked to a few people in the UK that have had those same frustrations with the NHS. And then most people end up going private.
Yeah. Yeah, and that's exactly what happened to me, and I am grateful every day that my family made that possible for me, because it really did get to a point where I didn't know how I was going to carry on anymore.
Yeah.
So yeah, I did research on various kind of endo specialists in the UK and found Dr. Peter Barton Smith, who is based in London, and runs the endometriosis clinic there. It's all private, unfortunately. He does not see NHS patients. So I had an initial consultation with him in September, and how he runs things, he has a somebody who does an ultrasound for you on the same day, and then you get your consultation straight after the ultrasound. Because he has a lot of patients coming from overseas, so it's kind of this one-stop shop.
Right. Kind of
um,
get it all done. Wait,
yeah.
Ellie, I want to pause you right there. How did you figure out it was endo? You said you were doing your
Oh yeah.
research. I
Yeah.
interrupted you. Did you get down a rabbit hole and then find the word endometriosis?
So I had actually heard of endo. I was
Yeah.
aware of it, but I had that really, really ignorant understanding of it just being painful periods. And because I was in daily pain and had all these GI issues, I was like, it can't be that. And I think the day that I had sort of the revelation, I was actually listening to your podcast, because I think what is so amazing about it is it really showcases how differently this disease manifests. And there isn't anywhere you can go and look online and see the absolute huge range of symptoms,
Yeah.
the way in which it develops differently for different people. I mean, I remember, I can't remember her name, I'm afraid, but you had a guest on who had a similar experience to me, where she just had like a moment of the like severe stabbing pain, and that just started off a whole new kind of experience after that. It was like the pain switch had flicked on, and that was it.
And then it's
Um,
daily, right? Like
yeah,
after that, it's like the inflammation got to an unmanageable point. And now you're so sick every single day. Yeah.
Yeah, it was listening. Honestly, your podcast was the main thing that helped me.
Oh.
It really was. And also putting together, and I would really recommend this for anyone who's kind of trying to get a diagnosis, going through all your medical history. So if you're in the UK, you can now access all of that via the NHS app. I think generally you just have to go and ask the receptionist in your GP practice, fill in a form, and they give you access to all your records. And I basically made a spreadsheet of all the visits with related endo symptoms that I'd had from age 11 to 29. And it was so eye-opening. And it was just like, I think I'd blanked out a lot of the issues I had when I was a teenager, particularly because I struggled with mental health so much. There's still a lot of my teenage years that's quite blurry. And I think I really hadn't remembered how bad it was. And yeah, so it was just.
Well, that was probably protection. You were protecting yourself because you had so much trauma going on in your body at such a young age. Right? Yeah. And I want to dig into the mental health too a little bit, but yeah, when you're in it, I understand what you're saying. Like when you're in it and you're living it, you're just living, getting by day to day. But when you actually write it all or put it, I have a binder, very old school. I did finally put it into like a timeline. It's really like, oh my goodness. But on a day-to-day basis, this is just your normal. So you don't realize how long something's been going on or how severe. That's why I always tell people document, because you start to really see the cyclical nature of things and how long something's been going on. And then you can go into your doctor armed, which is what I really always tell people to do, because then you're like, here you go. Look at all of this. Like, I'm not making this up. It's not in my head. This has been going on for 20 years.
Yeah.
Or whatever.
Absolutely. Yeah. It was, that really, really helped me kind of solidify it in my head. And don't get me wrong, I still had those days where the self-doubt would creep in and I'd just start thinking like, am I massively overreacting? Have I just got a really low pain threshold? Can I not deal with pain? You know, all those questions. Mm-hmm. And that's from years and years of medical gaslighting. And so many of us in the endo community have to deal with that. But, listening to stuff like this, you are just constantly reminded to listen to your own body and you know it best. Yeah.
You know when something's off, and so you shouldn't have to, and it's frustrating, but you have to keep fighting until you get the right answers. Mm-hmm. So you basically put two and two or a million things together and you were like, I think I have endometriosis. Is that when then you reached out to this endo specialist, or did you find some support groups, or what were your next steps?
So joining support groups on Facebook. There's a great one for UK patients, which was really helpful. I think I went back to my GP first and suggested it to them, which they didn't dismiss, but they basically said, you're already I was already waiting for referrals, and to just wait for the gynecology referral, which at the time, so I got that referral through in March 2022, and they were saying that the earliest appointment was January 2024. So yeah.
Wow.
Yeah, it's in a really, really horrendous state at the moment. With the NHS, it's just on its knees. And I had seen emergency gynae a few times, which they got me through to immediately, but because all my bloods were relatively normal, I'd just get discharged straight away. So at that point, I sat down with my partner and we just said, well, we can't wait that long. At this point, we're just going to have to find the money somewhere and go private. I had this initial consultation and had the ultrasound with Professor Davor Jurkovic, and I really hope I've pronounced his name right. But he specializes in endometriosis and he works with Peter Barton Smith. So you go for your ultrasound there first, and I remember lying on the bed and he hadn't even been doing it for about 2 minutes, and he said, I can see a nodule of endometriosis there.
Oh my
And
gosh.
yeah, one of those other moments in your life that you just know you'll never forget. And yeah, I think he found that there were quite a lot of adhesions and that the uterus wasn't freely moving. So that was clearly like kind of frozen. And yeah, and had my consultation with Peter, which is he does amazing 1 hour long consultations, and he listens. He doesn't question you. He's just been absolutely fantastic. Um, so we spoke through our options, and essentially because it was deep infiltrating, ablation wouldn't have been. He doesn't do ablation anyway, but we were kind of talking NHS options at this point because private surgery wasn't really, on the
Yeah.
cards then. So he said I would need to be referred to, I think we call them the BSG centres over here, the British Society of Gynecologists, where the excision specialists are. But these are the centres that have like 2-year waits,
Yeah.
because there are so few excision specialists in the country, essentially. So he said that, surgery wasn't absolutely essential in terms of like, I needed life-saving emergency surgery. But obviously we discussed the impact it was having on quality of life. And for me, it's kind of a no-brainer that needed to go forward with it. So yeah, we had a discussion about um, if he could do it and costs and so he does robotic assisted excision. He gave us all kind of the results he's had so far, and most women experience this kind of significant reduction in pain to surgery. It's not, we all know it's not a cure. And yeah, we went away, had a chat about it, spoke with our family, and yeah, it was essentially my parents and my partner's grandparents that made that possible for us. And
Wow.
I will never be able to thank them enough for that, because yeah, it really did give me my life back. So yeah.
When did you have the surgery?
So it was all a bit of a whirlwind. I had my surgery 2 weeks after my first consultation. And
Wow.
he just so happened to have a slot, and the wait after that would have been a lot longer.
Yeah.
It also, I feel like it was one of those moments of the universe just on our side, because I'd actually somehow through all this been applying for this new job at my place of work, and was due to start that in November. So meant that I could have got the surgery done before I started the new job, because I was thinking, how am I going to start a new job feeling like this?
Right.
So yeah, it was, I think, the 11th of October last year. Yeah, that was all very, very nerve wracking, but overall, I was pretty lucky with my experience, I think.
And how are you feeling now?
So a lot of my symptoms have improved a lot. Post surgery, in like the first like 4 weeks, I couldn't believe the difference so quickly. I still was obviously having the kind of the pain from healing, but that real like burning, constant, deep ache had gone, and it was just like I'd forgotten what it was like to live without that, which was incredible. Um, my nausea went so quickly. Um, the I had a lot of, I don't think I've mentioned this yet, but I had a lot of bladder symptoms. So I had a lot of like urinary retention. So again, I was just going a lot throughout the day, had a lot of stress incontinence, even though I think my pelvic floor was kind of over tight, but I think that was causing some of the issues as well. Really helped with that. Um, just have a look at my notes, sorry.
No, don't be.
The periods were still, the first few were still really painful,
Yeah.
but only for like 2 or 3 days. And it was like I wasn't getting that leading up to the period pain. It was almost like I remember there was one where I started my period and I didn't even know I'd started, which literally would never happen to me.
Right.
Because like, what?
You used to get a long lead time of a warning that it was coming. Yeah.
Yeah.
Wow.
And yeah, so generally, I mean, things are completely different in life now. We went on holiday about a month ago, which we haven't been able to go away anywhere. doing a lot more things. As you can see, the state of our room, we're decorating finally, because we bought our first flat together last year and just haven't been able to do anything because I've just been kind of in bed the whole time. So yeah, overall doing a lot better, but struggling unfortunately with a lot of chest and rib symptoms now. So for a long time I've had a pain in sort of my left kidney area, which always felt like this kind of dull ache. And because it was so minimal compared to the pelvic pain, it was like, well, that can just go on the bottom of the list for dealing with because I can deal with it. It's fine. It's just annoying. And then after my surgery, it just started getting worse and worse month by month. And then it spread to round my ribs and my kind of under my bra line, sometimes in my shoulder blade, in my back. And it was cyclical and my heart started to sink. I remember saying to my partner, I just pray this doesn't come back next month because I have a horrible feeling about this. And then in January of this year, right at the beginning of the year, I had a really bad chest infection. And after that, the pain that I had with my period, after that, it cleared up for about a week, and then my period came, and the chest pain was just like somebody had put a knife through me. And this is kind of just been gradually getting worse and worse now. So I had my 6 months post-op appointment, and spoke about it then. And yeah, he did say, your symptoms are in line with thoracic endo. So I have literally last week just had a consultation with a thoracic surgeon, mainly at this stage because I want to know what I need to rule out, because a lot of all my symptoms are left-sided, which as you probably know is more unusual for thoracic, and obviously I'm getting a lot of pain which feels like in my heart area, and not irregular heart rates, but I can feel like my heart in my back when I lie on it really, really prominently. It's like a banging heart and lots of kind of sharp pains and things. So it's obviously really worrying when you get anything at left arm pain as well. But of course, because anxiety is on your records as well, they're just will straight away just say, it's your anxiety. And then of course, me suggesting it might have spread to my chest cavity is me being over anxious probably, and so yeah, that is kind of the next hurdle, but it's not every day yet, and I'm still struggling with pelvic pains from time to time. I know that stress is a massive trigger for me, and yeah, I just know exactly the cause of the flare-ups now, and I've also the pain's kind of changed in that it definitely feels like this like inflammatory. I get the kind of pulling pains as well now, which seem more like adhesions. So I think I want to look at potentially getting some pelvic floor therapy at some point. Again, that's really difficult to access on the NHS. So it will depend on kind of finances for that. But I know that's helped a lot of women who I've heard, spoken to or heard on your podcast. So yeah.
Well, thank you. Thank you so much for sharing that. And I'm so grateful that you are feeling better, but I'm sorry to hear that now you're having this additional pain. It's interesting that you mentioned, I think it's good for the listeners too. And I'm sure other people have experienced this. It's like, once you get some of the more painful things out, then it's like exactly like you said, that pain that you kind of felt, but you're like, I was chuckling because I was very similar. We're like, oh, I don't need to worry about that pain right now. I've got this other major pain over here that I need to worry about. But then as soon as you have the surgery and everything kind of calms down, then you have this kind of other nagging thing. And you're like, was that there before? And now I'm just noticing it or, is it now just getting more upset or angry? Yeah. So I think you're taking the right steps in figuring it out. And, that's a good thing to do, and just keeping an eye on it, right? Tracking your pain, exactly like what you were talking about.
That's it. And I think so much of it is the uncertainty that's so difficult as well. You
Yeah.
know, I I remember before I got even the endo diagnosis, just every single day the mental capacity was that's taken up with thinking, what on earth is wrong with me?
Yeah.
Because some days, like I've heard it so many times in your podcast, you literally feel like you're dying. Like you know that something is so wrong,
Yeah.
and yet everything just keeps coming back normal, and you keep being told you're fine. And
Yeah.
I think that's what's frustrating now is that, you know, they don't know much about pelvic endo, but they know even less about thoracic endo.
Yeah.
And whilst with pelvic endo, usually your only option is to get surgery to get a diagnosis. I mean, I think I was quite unusual in that I managed to get a scan by an endo specialist, and it was also deep infiltrating, so it did show up. But, you know, so many people that doesn't happen.
Yeah.
But there's just nothing else they can do. They've said, you know, a CT and an MRI is not really worth doing because it's very unlikely anything will show.
Yeah.
Um, they have suggested that I try and somehow get an on-demand X-ray appointment, and I have no idea how I'm going to do this through the NHS. Next time I have a bad flare, or probably on my period, to see if there is any lung collapse
Yeah.
going on.
Yeah.
So yeah, that's kind of the next step for me. And if that is happening, then I'll probably go back to the consultant and see what he suggests.
Yeah.
Um, yeah,
And just watch it, like exactly what you're doing. Just watch it very closely and just keep a really good data on what's going
mhm,
on. But
mhm,
I guess not really, but the silver lining, at least you know that it's possible. And so if your lung hopefully never collapses, but if it does, at least you can say, I have endometriosis. This is most likely reason why this is happening. Where some patients, their lung collapses several times and then afterwards they figure out that they have endo, which is, it's
yeah,
just insane to me. But yeah, it all goes back to the care and the access to care and just the awareness about the disease. It's
mhm,
something that obviously why we do this show is just to
yeah,
get the word out there. And because you mentioned this earlier, it manifests so much differently in everybody that it's so hard to nail down symptoms. Some people have diarrhea, some people have constipation, some people have zero symptoms. Like it's really wild that it
it really is.
manifests. It's so crazy. So I want to also touch on the point really quick about this is something I definitely struggled with too, and I'm sure it contributed to my anxiety, but every time I would have like a pain or exactly like the rib pain or like shoulder pain or left sided pain, right sided pain, it would almost be like a PTSD reaction of, oh my gosh, am I sick again? Am I going to have another surgery? And I would just get into this spiral of kind of freaking out because I just was like, I don't know if I can go through this again is basically
Mhm.
how I would get into these like, how could we not be anxious? We have this chronic illness that a lot of people don't know about that causes inflammation. And then you have these symptoms that people can't explain. Like,
Yeah, I can totally relate. It's so hard to ever switch off from it. I mean, I'm sure you're the same. I don't really go a day without thinking about my endo in some capacity.
yeah,
Um, and sometimes for me, it goes the opposite way in that I am really good at just forgetting and ignoring a pain once it's gone. So when these chest symptoms started off more cyclical, you know, once they've gone away, I just think, oh, you know, it wasn't that bad. It's fine. You know, it's probably just I've pulled muscle. You know, I've been through physio and all sorts, and you know, I've been told a lot that it's musculoskeletal. Um, and when I had this appointment with this thoracic consultant last week, again, it was a private consultation that we went for. I remember talking to my friend and I was saying to him, but you know, my pain, it's not that bad today. Now I'm, you know, feeling bad. Should I really go? You know, should I waste their time? And all that. And why would anyone else why would you recommend that anyone else doesn't see a specialist just because they're having a week without any pain but the other 3 weeks of the month they are in pain, you know? But it's so hard when it's yourself, to get out of that I'm wasting their time mindset, particularly in the UK with how understaffed the NHS are, how overworked they are. They it's yeah, it's hard not to just leave things until they're absolutely their worst.
Yeah.
But I think last year was more of the wake up call to me to, you know, how many years did I spend just masking my symptoms and just, you know, going on another implant and thinking, yeah, it's fine now because I won't get another period for a year or 2 years.
Well, I just think we as patients were like, oh, we're overreacting because we were told that for so many
Mhm,
years.
mhm,
I just, I still struggle with it too. Like, oh, it's fine. It's okay. No, it's not. Like, it's not fine. It's not okay. Like, this isn't normal. But I still, I feel that same, it's almost like a guilt. Like I have like a, well, today's better. I don't need to go. Very similar to you. And then I'm like, then the next day you could be just like lying on the floor. You don't want to miss the opportunity to get into that appointment.
yeah,
It's a real challenge. And again, I feel like it's like almost like a trauma response where we're just like, no, we're fine. I remember I had a cyst rupture. I was home alone. My husband was out of town. And I remember being like, oh, I'm fine. Like literally blacking out. Like, oh, I'm fine. I'll just rock back and forth and get through it. And then I was like, maybe I'll Uber to the hospital. And I ended up never going and just struggling through the whole thing.
mm,
Why would I do that? Because I didn't
yeah,
want to go for you guys A&E, but I didn't want to go to the ER because I had already gone so many times and everyone told me it was normal or that I had a very similar, like you have a UTI. I mean, it was just, there was never any help there. I hate to say that, but there wasn't.
no, no.
So,
Um, I will do anything at all costs now to avoid ever going back to
same.
A&E. It was
Yeah.
just horrific experiences. Yeah, really, really
Yeah.
traumatic.
Yeah, definitely. Um, So as we kind of wrap up, is there anything that you want to mention, like that have helped with symptoms? And I know we've talked about mental health a little bit. Any mental health things that you've done to help? Any tools, tips, tricks for patients who are listening that have anything that's kind of really helped and worked for you?
Yeah, sure. So I think like a lot of people, heat is really, really important for me. So I know that sounds like an obvious one, and probably everyone listening probably already does that. But I got myself a body bottle. I think you can get various different makes of them, but they're like a long hot water bottle, and you can tie them around yourself. And that has been incredible. I do use kind of meditation techniques quite a lot. When I went through the kind of really, really bad spell, and they put me on codeine, morphine, all the kind of strong opioids, and even that wasn't. It was kind of dulling the pain, but it wasn't giving me that respite I needed from it. And I think I just got to a point where I said to my partner, "Right, screw it, let's try some meditation. I'll try anything."
Right.
So yeah, I do. I'm not going to say it's like some kind of magic cure. It's not, but I think because I struggle with anxiety anyway, sometimes when the pain is getting so bad and you do get into that panic state of when am I going to get relief from this? Because how many moments have we had where we'd rather just go unconscious because you just can't deal with it anymore? And yeah, just getting more kind of mindful, doing meditation techniques has really helped. I would like to. This is not one that I've tried, but I would like to try some acupuncture, particularly with my kind of neck and shoulder symptoms. I've heard that can be quite helpful. Um, oh, another thing, I regularly take supplements now, and it's really difficult to say how much they make a difference because I started taking them kind of just before surgery. So a lot of the improvements I've had have been probably surgery related. But there's a company in they're UK based called Wild Nutrition who make completely organic food based supplements, and they do one called Endo Complex, which has essentially got ingredients in it that are all taken from mostly cruciferous vegetables, I think, which help metabolize estrogen. So I just keep on top of those. Yeah, I haven't cut anything massively out from my diet other than alcohol is an absolute no go for me now. That really, really sets me off. I've kind of got an awareness of dairy definitely makes me flare if I have a lot, but generally if I'm just having kind of a splash of milk and coffee, like most days, it's fine. But I think my diet is probably the next thing I need to tackle a bit more seriously in terms of eliminating specific food groups for a long period of time and seeing if that can help. Although, the surgery did massively help my GI symptoms anyway. They're pretty much back to normal, apart from when I eat something that I probably shouldn't eat. So, yeah.
Like big bowl of ice cream or something like
exactly.
that.
And that's what you want when you're on your periods. So.
Of course. You're like, where is the ice cream? I need it now. Okay, good. Well, is there anything else we didn't cover that you want to add?
No, I mean, I think, and I know a lot of your guests say this, but please just believe in your own body and trust yourself. Because I spent so long not doing that. And you know yourself best. You really do. And don't listen to what some of the doctors say.
Yeah.
I think for any people from the UK listening, like, I'd definitely recommend joining the Facebook support group. That's a really, really helpful place for information on how to get care through the NHS. Unfortunately, it is in an absolute awful state at the moment, and wait lists to see an endo specialist are horrendous. But, there are a lot of supportive people on that group who are there to, rant away with you when the pain insomnia is keeping you awake at 3 a.m. and you just need someone who understands, because it is mentally and emotionally such a difficult thing to deal with. And it's really hard to, I'm very lucky in that I have a great support network, but it's very, very hard to talk to somebody who hasn't got it and doesn't understand it. And actually being able to talk to other people who are going through the same thing is really important, I think.
Yeah, I agree with that. It's helped me so much just to have someone that you don't have to explain. You can just say, this is what's going on, and they understand.
Absolutely.
Yeah. Well, Ellie, thank you so much for coming on and sharing all of your story and details. It's been very, very helpful for probably everyone who's listening. So really appreciate it.
Well, thank you for having me. It's so lovely to meet you, and thank you so much for everything you do. You really are such an asset to our community. It's an amazing podcast.
Thank
and
you
everything
so
else
much.
you do.
Oh my gosh. Thank you so much. Thank you so much.